Because we only have a half hour with the lady from the Department of Insurance, or the Insurance Commission, to discuss some of the issues that we've had with Obamacare and how it affects the counties and stuff. So we're gonna go ahead and get started. I don't know if anybody else is coming or
No,
not.
it's
but
time anyway, so.
just because we have this half hour time frame.
Yeah, 10 o'clock anyhow, so good to go.
And just so you know, Christina is who we'll be conferencing in. She is legal counsel in the Commissioner of Insurance's office. She's also nationally accredited expert on healthcare reform.
Sharon, I'm
So
leaving it to you.
her name is Christina Go.
You can answer when she answers.
It's Christina Go.
Hi, Christina. This is Shelley Murphy with Mako Healthcare Trust. How are you?
Fine, how are you?
Good. I've got you on speakerphone with Mineral County. If you would like, we'll go around the room and introduce ourselves.
Yeah, I just wanted to point out that I have to give a speech at 11, and so I have to be done here right at around 10:30.
Okay, no problem. We appreciate you taking some time for us. Okay?
Thank you.
You bet.
Hi, this is Lori Johnston, Mineral County Commissioner.
Roman Jalawi, County Commissioner.
Dwayne Simons, County Commissioner.
Cindy Grimm, Secretary.
Kelly McLeese, Deputy Clerk and Recorder. Shandell Anselmo, Deputy Treasurer.
Sharon Patterson, Extension Administrative Assistant.
Okay? So that's who we have joining us, Christina. And they have put a few questions together that came from some of their employees, mostly surrounding healthcare coverage and the new healthcare reform. I think I had sent Emily an email yesterday that let her know one of the biggest concerns that had come up is a certified counselor came and visited with them, and in that conversation, it was basically presented to Mineral County that the best way for employees to be eligible to afford spousal coverage was to go out to the marketplace and apply for that coverage. However, Mineral County was encouraged to possibly drop spousal coverage so that they would qualify for a subsidy. So that in a nutshell has generated a lot of questions. What is Mineral County going to do? How are they going to do it? Again, I haven't had a chance to visit yet with the commissioners in terms of their game plan, but I do know that they have lots of questions for you as well. So, would you like us to just ask a few of these questions that have come up from the employees?
Yeah, sure. But first, who encouraged them to drop spousal coverage?
Yeah, Christy Scott. She's a
Christy Scott being their agent?
No, she's a counselor. She's a certified counselor, healthcare reform counselor, and she works at the community.
I don't disagree that that's something to consider. I would just like to point out that certified application counselors really are not trained to give advice to employers, and neither are navigators. So how many employees does Mineral County have?
About what, 60, 55?
50, I thought 52.
I think our
Okay,
current
so
admin is right
you're
about
over 50 if you're over 50 full-time employees, you're considered a large group. So CACs and navigators specifically have not been trained and are told not to give advice to large employer groups.
Okay.
So I just want to make that clear. And if you just want me to, I can talk about the spousal issue for a minute, and that is, as a large group, federal law requires you to offer coverage to your employees and their children up to age 26. It is silent as to spouses. So many people have interpreted that as that, the employer has some discretion in which dependents they offer coverage to. They have to offer to children. The ACA has answered that question, and they have to offer to adult children. But there isn't a requirement to offer to spouses. However, you need to do more analysis than just that. The fact that then the spouses would be free to go to the exchange and possibly get a tax credit. That is true. But those kind of decisions have to be made with your own financial analysis, sort of. How many employees do you have that would be helped or harmed by this? I mean, are they all low enough income that their spouses are going to qualify for tax credits? Is the coverage actually cheaper in the exchange for that spouse than it would be in the health plan? And how many employees do you have that could actually be harmed by that decision? Because if there is an employer group for the family coverage, additional they can accrue additional tax deductions that they wouldn't be able to get in the individual market. And that's why it's really kind of a question for an insurance producer or an insurance consultant that also does this kind of financial analysis.
So Christina, would you back up just a hair and tell me again, you're saying they could be eligible for other tax deductions?
Well, if you look at some of the literature, some economists say that when your household MAGI gets to about 300% of federal poverty level, depending on the size of your family and other things like that, you may actually be better off in employer coverage because you can get you have access to flex plans, cafeteria plans. You can get your premium and other health care costs paid with pre-tax dollars, and sometimes those tax deductions or exemptions are more valuable to that family than the tax credit they would receive in the exchange.
Got you. Thank you.
And when does your policy renew?
July 1st.
So if you were offering coverage to spouses previously and you decided not to offer to spouses any longer, then if that spouse had coverage through your plan and lost that coverage because of this decision, then they would have a special enrollment opportunity in the exchange. However, if they hadn't signed up for the coverage anyway and you made this decision to not add spouses, that wouldn't be a special enrollment event for that person.
Gotcha. So if they were covered, they could enroll, but if they were not previously covered, then that would not qualify for a special enrollment.
Yeah, they'd have to wait to open enrollment, which starts November 15th.
Okay.
But again, it depends, and it totally hinges on if the plan decided to stop offering coverage to spouses. But I can't emphasize enough that it's not just a cut and dry decision. There is, it's much better to sort of look at the whole financial picture and then make a decision.
Gotcha. Christina, can you talk a little bit about I've done significant research on this since this issue has come up, but just to clarify, if a spouse has coverage through his or her spouse's employer, if that spouse goes out to the marketplace, they could enroll in a marketplace policy. However, they would not be eligible for a subsidy because they do have employer-sponsored coverage available. Is that correct?
Yes.
Okay, so one of the questions that had come up is why is that reasoning? Because there is a loophole, so to speak. There are many employees that
Right,
don't
right.
have the funds available to pay for the spousal coverage on the employer insurance. Therefore,
Right.
they're thinking they can get a cheaper plan on the marketplace, but they're, also looking for that subsidy, which obviously isn't available because that employer-sponsored coverage is available.
Well, why would be the $64 million question.
Okay.
It's an IRS decision. It's an IRS regulation. It's been a hotly disputed rule since it was passed, but I've seen no movement to change it. It's really the IRS's interpretation of the affordability of employer coverage is based on the cost of employee-only premium, and yet it's compared to the household magi for purposes of determining the percentage, and it's not fair. But I can't defend it as being fair,
Gotcha.
but it is the IRS rule.
Okay. And another question that came up is, if you don't mind, Christina, for the benefit of the county, would you talk a little bit about the pay or play mandate that's coming down the pike in terms of penalties if the employers or the employees were to go out to the marketplace and obtain coverage? Would you talk just a little bit about that?
Could you repeat the question, please?
Would you talk just a little bit about the pay or play mandate that's coming down the pike for employers and how that affects
okay.
them, how that works?
Well, if you in fact do have 50 or more 30-hour-a-week employees or full-time equivalent and part-time, then you will trigger the employer responsibility requirement. However, the penalty for not providing coverage, and this is only for providing coverage to the employee and to their children, okay?
Non-spousal dependents up to age 26, is that correct?
On child dependent, not dependents, adult children and adult children up to age 26.
Okay,
Yeah.
perfect.
It doesn't matter if they're married, if they're students, if they have access to other coverage, if they're financially dependent. It's just a flat offer to age 26. So the penalty for that has been waived for 2015, and pursuant to guidance that I think was issued in March, for employees under 100, which you are, the penalty has also been waived for 2016. In 2016, the definition by operation of small group goes to 100 employees. And that would make you a small group employer instead of a large group. But what that will do to the penalty for employers that are 50 to 100, I don't know yet. I don't know whether currently in the ACA, at least after 2016, you would be subject to a penalty of, and I can explain how the penalty works. It would take a few minutes, but
Yeah, if you don't mind, maybe Christina, just letting them know what that penalty could potentially be.
okay, in a nutshell, if you offered no health plan, if you offered no coverage, then the penalty would be $2,000 per employee if even one of your employees went to the marketplace and received a tax credit. It would be $2,000 per full-time employee, 30 hours or more, minus the first 30. That's the formula. If you offered a plan that was minimum essential coverage, but either was not affordable for that employee or meaning it didn't meet the 9.5% test, or did not have minimum value, which is a actuarial determination that CMS does, then that employer could get a penalty of $3,000 for each employee that went to the marketplace and received a tax credit. So there's two different ways to calculate the penalty.
So Christina, all of the plans that they offer do meet the minimum essential requirement, so it would just be an affordability calculation for them in relation to that pay or play mandate. But,
Right.
so what I'm hearing, and again, we haven't had a chance to visit, but if one employee were to go out to the marketplace and receive a subsidy, the employer could be held liable for up to $3,000 per employee as a tax penalty.
Right. But the employee could only get a tax credit if he was able to prove that it was unaffordable or didn't offer minimum value. And
Okay.
minimum value is a different calculation than minimum essential coverage. Okay? So who's their insurer?
We are, Mako Healthcare Trust.
Okay. So you've done a minimum value calculation using the IRS formula?
Yes, we have a benefits consultant and our actuary have done those.
Okay. Well then, as long as they have that coverage, they're fine on minimum value. They can estimate affordability based on just the employee premium and the employee-only income which they have access to. Obviously, that's not going to be an exact calculation. But the employer is supposed to provide annual notices to their employees advising them that the coverage they have, that they are offering them, is affordable and meets minimum value.
Okay, I think that covers all of the questions, Sharon, that you had submitted.
It does.
Okay.
And I guess if the commissioners have other questions that wasn't covered here, they could go ahead and ask them. If you have something,
I don't know.
Lori? Any of you have questions?
Do you think you understand it well enough if a question arises?
Well, I've done a lot of research in the last couple of weeks and in talking to Christina and Emily and whatnot. I'm getting well educated in a hurry, let's say that.
think
I'm by
we
no
all are.
means an
Yeah.
expert on it, but at least I'm understanding it a little bit better.
I do
So-
have a question. Christina, what is your last name?
GOE, G-O-E.
Thank you.
Okay. All right, well, Christina, if you have anything else for us, we would entertain that. Otherwise, I think we've got you off early.
All right, thank you.
All right, thank you, Christina, appreciate it.
Good luck with your speech.
Thank you. Bye.
Bye.
Have you met her in person?
I haven't actually met her in person. She came over through a referral, as in talking with Christy Scott. Then I was talking to her navigator that she works with, and they actually referred me to Emily Hammer in the commissioner's office and Christina as well. So
And what office exactly is Christina with?
Monica Lindeen's, the commissioner of insurance.
At the state? Yeah. So if, let's say, if I had the insurance here, which I don't, but if I did, and my wife had MS, and I didn't want to pay the higher cost of adding my spouse, she could go out and get the exchange or Obamacare or whatever, but not get a what's that mean?
The subsidies. So there are subsidies available based on household income, and it's based off of federal poverty level. Again, that's based on household income. the way that the law reads, or I guess the way it's being interpreted right now, is that if there is employer-sponsored coverage available to that spouse, they could still go to the marketplace and purchase a policy, but they would not be eligible for any subsidies. So speaking specifically in regards to Mineral County, there are several lower wage employees that can't afford the spousal coverage on the healthcare plan. When they look to go to the exchange and purchase a policy for less money, then they're hoping to get that subsidy, and they can't qualify for that because that spouse is eligible for healthcare coverage.
What's an example
here.
of a subsidy, so I know what you're talking
Well, when I was doing some playing around online, I spent about a week researching this issue specifically for Mineral County, and when I was doing some playing around for a household of one, and I used a 22-year-old person because theoretically they would be able to get cheaper insurance rates through the exchange because of their age. It was about $13.70 an hour was about the threshold that a person could make where they themselves wouldn't qualify for a subsidy. So based on that, and that's their household income. If you have, two people working, I mean, it would just be based on household income depending on what it is. But the costs of those plans for that person, 22 years old, household of one, was around $250 to $300 a month. But that was for much higher deductibles too. I mean, we're talking $4,000 and $5,000 deductibles. So the plan, the money out of their pocket is less, but the plan itself is much less. If they had to utilize that insurance, they would feel more money out of their pocket by utilizing that insurance than they would paying up front for better coverage. So when Christina was talking about doing a little research before you decide if you wanted to offer spousal coverage or not, I would definitely, and I can work on some of it for you, go out to the exchange, see what some of those policies are, calculate the yearly premium that a person would have to pay without the subsidy, and then calculate what a spouse would have to pay on one of the least expensive plans that Mineral County offers, and see what the difference is just in dollars out of their pocket. But then we'd want to compare benefits and, make sure that they're at least getting somewhat of a decent plan for that amount of money. So unfortunately, general healthcare users, the general population, don't understand that the reason those policies are less money is because if they were to utilize that, they're gonna have more money out of pocket. With those $4,000 deductibles, $5,000, some of them were even $10,000 deductibles. So, yeah, they're cheap, and they meet the minimum essential benefit requirements.
But
And
really,
but
$300 a month for someone who makes $13 an hour is not cheap.
no, that's
I
not
mean,
cheap,
it's-
and that's exactly, either way, the sickest part about healthcare reform, and as Christina said, she can't defend it, it's not right, but there's loopholes out there, and it unfortunately falls for the people that are just at that threshold where they make just a little bit too much, but yet they still don't make enough to pay for health insurance or a significant amount out of their pocket. And I mean, there's nothing we can do about it. The only other way that if Mineral County wanted to, you could potentially look at changing your rates around and loading your employee-only coverage a little heavier to make a more family-friendly rate, so to speak. That would potentially help ease a little bit of the sting in terms of the cost for the employee spouse, employee children, or employee family coverage.
Say that again, how would that,
I was just gonna,
yeah.
What does that mean?
Yeah.
Yeah, so, look here, I don't have I have to get my form actually from you, or from you guys, I'm picking it up today, that you signed to pick the policies and what the rate plans were. So let's just say, for example, right now, your employee-only coverage, you pay $600 a month for that employee-only coverage. And typically, employee spouse coverage is double that, so it would be $1,200 a month for employee spouse coverage. What some counties have chosen to do, and not necessarily because of healthcare reform, but just in general, have chosen to incorporate more family-friendly rates. So if that $600 is employee only, we have tiers. It's 2.0 for the spouse, which is double. I think it's usually 1.72 for employee children and 2.81 for, those are the rate factors that they use to calculate those rates. And 2.81 is for the employee family. So what you would do is load your employee only, say bump it up to $700 a month or $750, so that those rate tiers using to calculate the employee own, or the employee spouse, employee family, employee children rates would drop, so that those premiums drop. So you're loading the employee only portion heavily to help alleviate some of the dollars on the employee family coverage or the employee spouse or the employee children.
Without changing deductibles and all that stuff?
Yep, same plan. All you're doing is just prematurely adding a dollar amount or a specific factor. Let's say you want to pay $700 per employee, when really that premium should only be $600. So you're loading that employee only rate by $100 extra, but that $100 extra that you're loading in turn helps decrease the rates for the other tiers, the employee family,
Be similar to
employee.
what the healthcare reform thing is doing. It's a subsidy. I mean,
It's
if you look-
it's
yeah.
subsidizing the employee family, employee children, or employee spouse's rate by loading your employee only rate. But the problem with that, and we don't suggest that, however, we do have counties that are on family-friendly rates. That's what we call it, when you load the employee-only portion to help subsidize the other tiers. We do have several counties that do that just to help their families out. But the flip side to that is, do you use permissive meals? So that affects your permissive meals, obviously, because you have to,
Paying
yep.
for that.
Yep. And the other problem is at some point, if we load the employee only to help the families on a scale, at some point, we're going to have to bring it back to even. There's just no way to get around. You can't continue to load your employee only portion. If it gets $800, $900, $1,000 a month, Mineral County just cannot afford to pay that. So you have to figure your rate increases, and we've done really good with our rate increases, but if we continue a gradual increase, medical trend is 8 to 10% a year for increases. So if we were try to keep it on a gradual and do small 3% rate increases or similar, you still have to figure those rate increases in, and you would probably have to continue to load the employee only to help absorb those rate increases. So your employee only is going to be so heavy that at what point can't Mineral County afford to do that? So at some point you'd have to even it back out. That's why we don't recommend it or necessarily suggest it, but it is an option if you
It's
had.
like a short-term benefit.
Yeah.
Like you said, in the long run, it's gonna catch up.
In the long run, it's going to have to even out no matter what. So we've actually had, Cascade County just came on with Mako Healthcare Trust, and they have had, I'd say, somewhat family-friendly rates, but their plan has been very much a high deductible. Like their family out-of-pocket was $12,000, so it was a really kind of high dollar plan. They chose this year when they came on to just go right to those standard tiers and not do any family friendly. And the reason they had looked at some family friendly tiers was to ease the family or those, employee children, employee spouse, employee families, ease them into the standard tiers of what is industry specific in terms of what families have to pay for health insurance. I mean, it's just saddening, But truly, when you look at the plans that are offered and the cost of those plans, even the basic plan that we offer is better than, I'd say probably 95% of any plan you'll find out on the exchange. And it also tends to be our cheapest plan. And the cost of putting a family on the basic plan, you go to try to find a plan similar to ours and insure your family for that much, it's not gonna, I mean, you're not gonna find it. So it just is the cost of health insurance. It just is what it is. So there are a few options like that to help take the sting out of the cost, or to help some of those family covered employers or employees out. But I would strongly caution Mineral County to really look before you did anything like that, because it's the cost of health insurance. And it's not, we have some very extravagant, rich plans, but we also, as I said, have the basic plan, which Mineral County does offer, which is better than probably 95% of the plans that a person could go get on the exchange anyways. I mean, it's a $2,000 deductible, $4,000 family deductible, and then we pay 70%, and your max out of pocket is $8,000. You know, and while that sounds like a lot, again, I would challenge somebody to go to the marketplace and bring me a better plan for less money that would cover an entire family. So, I mean, there's those loopholes in this healthcare reform, and there's nothing that we or you as an employer can really do, and it mostly affects the employees that are right on that cusp of making a little too much and not enough to pay for it. And in regards to the specific spousal issue that came up, we did talk to Mako Legal Counsel as well as our benefits consultant, and that would be a specific Mineral County employment policy. That would not be something that Mako Healthcare Trust would take a stance on in terms of not offering spousal coverage. That would be something that Mineral County would choose to do in part of their employment policy, is that just not offer it. That would satisfy those spouses being able to go out to the exchange and possibly receive a subsidy, again, based on household income. But they could be eligible for it then if they weren't eligible for employer-sponsored coverage. However, I would, again, highly caution you when you look at that, and if you're making those decisions, I would highly caution you to, as Christina said, look at all of the employees and get a census of how many spouses you have covered on the plan versus how many employees it could affect, you know. And ultimately, your responsibility as the county is to the employee, it's not to the spouse.
Mm-hmm.
So, you know, I don't really know how else to say it, but that's pretty much it. It's to the employee, not the spouse. And with the loopholes in healthcare reform, that's not something that we as employers or you as the county can take responsibility to try and fix the loopholes or to help your employees adjust to the loopholes that are in healthcare reform, or the mandates coming down that every person has to be covered. I mean, it's a tough situation. Cascade County called me actually yesterday on the same type of situation, and their certified counselor is actually telling them to drop family coverage. Well, you can't do that. You have to offer it to dependents age up to age 26. So again, it's the spouse that really that's the only opportunity that a employer could do anything with, is the spousal coverage. That's it. And, you know, that would be up to each individual employer.
Well, we had a conversation, Stacy and Kalan and I had a conversation with Marcia last week with the same question: what do we do with spousal, you know, coverage? And Marcia's advice was not to do anything right now, because because of the Affordable Care Act is in such a molding stage right now that we don't know what it's gonna do. And So her recommendation was to leave it as it is and do more research throughout the year and make a decision at a later time. Don't do it right now because there's just too many, it's such a liquid thing right now, this Affordable Care Act, that we don't know what's gonna happen. And I'd hate to see you guys make a decision and then have to come back on it and rethink it in another year. Let's let this thing play out for another year and just see where we're at in 2016 and when all of these penalties and everything start to kick in on employers and make a good sound decision and look at what the financial aspects are. And that would be, that was the recommendation from Marcia last week, was just hang in there the way it is this year. I know there's some people out there that are gonna be penalized because they can't get spousal coverage or can't afford the spousal coverage either here or on the marketplace, but I just don't know what else. It's not the employer's, I don't feel, let's put it that way, it's not your responsibility to make sure that all your employees can get the quote subsidies on the marketplace. You pay what you pay, they know, and I still think that even with spousal coverage and they go on the marketplace, that maybe there's some tax credits out there because of their low income, their income, but they're not gonna get the subsidies. They're gonna have to pay the $200 a month, but maybe through the tax process and when they file their taxes at the end of the year, that's when their tax credits would come in.
And truly, the people that we're talking about that are falling in that income gap, it's probably going to be cheaper for them to take the tax penalty the first year or two than it would be to even pay for health insurance every month for that spouse, which is the goofiest part of healthcare reform, is they make it so expensive and everybody has to have it, but the people that truly can't afford it, it's much cheaper to pay than, I think it's $95 tax penalty the first year.
Yeah, that's true.
So it's much cheaper to do that than it is to pay even $200 a month out of your pocket, which they can't afford anyways. So, and with Mineral County paying 100% of your richest plan, you don't have to worry about your employees not being covered or the affordability issues, this pay or play mandate, which I'll talk a little bit about as well. You don't have to worry about anything of that nature. It's truly the spouses or the children that we're talking about. The children, typically for people that fall in that income gap, most of those people would qualify to put their child or children on Healthy Montana Kids as well. I know of somebody making nearly $60,000 a year and their children are on it. So your first thought when you think of Healthy Montana Kids is that it's a low income plan for children, but it's really not. And I have calculations, and if people come and visit with me, I can direct them to the right spot. But there are options for at least the children to be eligible to go on Healthy Montana Kids. And then the employee only portion is covered. It's just the spouses mainly that we're talking about. And again, I think I would concur that your responsibility is to your employee and you take care of them. You pay 100% of that RM 1500 plan, which is outstanding, but that is something to chew on.
What's the ceiling on the Healthy Montana Kids, the income?
I don't know what the top, I think it's based on tax deductions and your household income and whatnot. I don't know, I actually haven't worked through the worksheet with it, but I do know that we just, Hill County is looking at coming on with us, and they have some complicated issues, but one of their biggest issues is that they've paid 100% of the health insurance premium for everybody. It didn't matter if it was employee family, employee children, employee spouse. They did it through composite rates, meaning it was $902, and it didn't matter if you and all 15 of your kids were on it or just you were on it. It was $902, and they paid 100% of it. obviously they can no longer do that. They're self-insured and they physically can't afford to do that anymore. So they are looking at going to the rated tier structure, as I was talking, where you have employee only, employee family, employee spouse, or employee children. And in doing so, well, they've essentially been subsidizing the hospital, the railroad, everybody up there, because even if your spouse works at the railroad, they're coming on to Hill County's plan because it's paid for. It's free.
Right.
So we've got a lot of pushback, and particularly has been with employee families, obviously, because they're the ones going to feel it in the pocketbook. And we actually went up there about a month ago and met with about 15 different employees, and I know for a fact one of those employees had 2 children on the plan and was making just about 60,000 and was qualifying to put her 2 children on Healthy Montana Kids. So I haven't actually researched to have specific numbers for you, Roman, I apologize, but I do know that that's an option, that's a viable option if people are needing to move kids off the plan or can't afford the kids on the plan. Of course, the issues come about mostly with spouses.
That's been the biggest thing is spouses. We have just one
Just my
family,
kids on the plan.
just one family with kids on the plan
And the
at
only
this
way we
time.
can do that is because Jason and I both work here,
Gotcha.
so that's the only way we can do it.
Yeah,
Because we just take a higher deductible.
yep.
But at this time, they're the only ones. I'm not, maybe down the road, there might be some people that want to put their kids on.
Okay, so we don't
But-
necessarily have to,
Yeah,
we won't have to worry about that too much, so then we're back to just spouses.
and it's just been mainly the spouse thing that's been the big question, and, but and after talking with Marcia, I would really, I'd say, give this Affordable Health Care Act another year to gel before any decisions on that are made. I feel bad that it's so expensive, but I don't know what else to. I mean, I've gone on the marketplace myself to look for insurance for my husband and to try to find a comparable insurance to what I have. It's costing, for my age of 64, his
Yes.
age of 63, it's gonna cost us probably $730 just to find something on the marketplace that is comparable to this insurance for him.
Just for him. So, I mean, it is based on age. Obviously, the younger the spouses would be, the cheaper the plans they'd be eligible for, but still, comparatively speaking, it's going to be more times than not, it's a major medical or a catastrophic, if you would, where the deductibles are extremely high. But that is their option to go look at that. And again, the way that the rate tiers are figured, spouses, the cost of spousal coverage is exactly double what the cost of the employee premium is, because that's 2 adults utilizing the plan. And typically, the cost of their adult care is more than even children care. Children might have an accident and get hurt, break an arm, something like that. Their immunizations, preventatives type things. But technically speaking, children don't tend to get as sick as, say, an adult. And usually when an adult incurs costs, it's surgeries, fixing things, shoulders, knees, those sort of things, osteo, hips. We have lots of osteo claims. Their prescription drug coverage is also significantly higher than the cost of children. So in industry standard, that's why the cost of the health insurance, which answers this first question on that form, Sharon, the cost of the health insurance is more for a spouse than a child because they cost more to insure. They have higher claims utilization, plain and simple, and usually the cost of their claims is higher on a dollar for dollar than children. So when we look at the rate tiers, and this is not anything that's a magic of the healthcare trust, this is industry standards, and it's what the industry does. When you look at the employee-only portion, double that. the tier structure for the employee spousal coverage, if employee is equal to 1, employee spouse is equal to 2. It's exactly doubled. Employee children is less, it's 1.72 is their tier factor, their rate factor. And that's because, again, children typically cost less to insure than an adult spouse or dependent. And then the family coverage, that rate factor is 2.81, using the children are in there, but then again, you have the spouse in there. So that's why spousal coverage is so expensive, is because they cost more to insure. And the dollar for dollar claims cost more than children would, typically speaking. Does that answer your first
Yep.
question good?
Peggy, that was your question. Does that
Yeah,
answer it?
here's what I did, and I just went on, the marketplace and just reviewed what the cost would be without any credits.
Okay.
And what I saw just by going in and looking at it, and I didn't realize they based it on age.
Mm-hmm.
I just looked at the basic rates, and what I saw was that, one of the rates, the, deductible was like 700 and something, and, the copay on, the only thing I can remember, the copay on medications was 0, and the actual fee for the cost of that plan was less than what we're currently getting now. But I didn't know they rated in age factor and depending on what that was. I just went in and just looked.
And also, if you might, if you have a little more time to look at that, because when I was doing some research on it, actually go in and when it brings up those plans and the costs, I think it says click here to select this plan or select this plan, and you can actually go in and see a summary of benefits for that plan.
So what I'd like to know is, so I know there's all these variables in a plan, you know, like catastrophic events and how much they cover, how much do you cap out at, and do they cap out at a certain dollar amount? You know, you have all of those variables, and I didn't get a chance to compare all of those different.
And that's what I would like to do, because for the cost of that plan, I want to know where, I'm gonna say this very lightly. The cost of medical coverage is the cost of coverage. Whatever that insurance company is going to offer you, whether they give you a discount in rate, they're going to get what they need, whatever pot of money they need to offer that plan, they're gonna get it out of you somehow. So if they do it by giving you a lesser rate and making you responsible for more in the situation that you would have to actually use the insurance, it's called cost shifting, that happens as well. We face this when we actually are working up rates or competing against like the Blue Cross, the Pacific Source, Montana Health Co-op, anything like that. Make sure you're comparing apples to apples, and that's what I would like to see. And I probably have time this afternoon if we want to, upstairs in the jury room, I think that's where they have me.
Yeah, I'd kind of like to look at that.
And we can
because
go
I
through and kind of
understand.
compare it.
You've
But
got
if
to
they're
do it.
charging you $400 a month, let's just say, where are they getting the rest of that pot of money? Or where is the risk being put
Right.
to get that pot of money for that rate? So I did see a few of those plans when I was researching, and I thought, well, this is much better, because I saw the rates and saw their initial short description of it saying no copay, $20 or $15 copay for office visits. But when I actually get into it and look at the summary of benefits, that's where I saw they had like a $6,000 deductible on any inpatient hospital or things like that. That's just off the top of my head, but those sort of things. So I would love to take a look at it, because everything that I've seen out on the marketplace, either the rates are typical for that plan and based on age, or if the rates look too good to be true, we want to look at the actual plan to see what kind of coverage you would get. Most of them that have a lower rate up on the upfront are more of a catastrophic type plan. So you might have a $15 office visit for your general physician visits, and that might work really well for those people that hardly ever go to the doctor. But if they ever had to utilize it, that's where the real sticker could be. So I would love to look at that and
Yeah, I was
definitely
just
play
curious.
some more.
You know, I'm not a proponent of
No.
either one, but I do like to look at,
Absolutely.
okay, what are you offering and what are they offering? and the-
Absolutely.
And the comparative price cost for that.
Yeah,
So,
I would love to put in some figures.
Yeah.
If we go in and put your household size, if you put your income in there, it'd say if you qualified for a subsidy or not, obviously. I played with it, there's a box that says, is anyone in this household eligible for employer-sponsored coverage? I purposely didn't check that to play with the margin factors. If you check it, it'll right away kick you out and say, you can still go look at plans, but it'll say you're not eligible for a subsidy. So if you don't check that, then you can kind of play and see what kind of subsidy potentially you would be eligible for if you didn't have employer-sponsored coverage. So we can play with it both ways.
So typically, when you said that you were looking at and comparing the current Mako plan with what's available on the
Mhm.
marketplace, that 80 to 90% of those plans aren't even comparable to the current plan that we have, and the cost.
Your employer, what your employer covers for
Right.
you,
Yeah.
that plan, you're not gonna find anything on the exchange out there that's, you might find something better, but you're gonna pay out the wazoo for that.
And so when you look at, and I just want to know,
Yeah.
so when you're looking at the differences, where are you seeing the differences in cost?
Well, I was mostly comparing to the basic plan, which Mineral County also offers, because it's typically our least expensive plan that the counties offer. It doesn't matter what county you're in, the basic, just because the way it's figured is our cheapest plan. So I'm trying to compare most everything to the basic plan. And I'll tell you the reason I do that. When we're talking about this pay or play mandate that's coming down the pike, when healthcare reform, when the IRS looks at affordability for the employee-only portion of their health insurance, what they will look at is the cheapest plan offered by the employer to the employees. Doesn't matter if the employee's on that plan, it's just the cheapest plan offered. So the basic plan is always our cheapest. And so for affordability reasons, all of our counties, we have 3 counties that currently don't offer it. However, I've encouraged them to offer it because of this pay or play mandate. So I've been comparing everything to this basic plan because that's the one that the IRS would look at when they start calculating affordability.
Right.
And
So maybe
even-
when I come see you, you can show me the difference.
Yeah, yeah.
We can look at that and look at comparable, because I'd be curious as to.
Yeah.
Just interested in seeing.
Yeah, I will play with it definitely while I'm up there. If I'm not busy,
Sure.
I'll start playing on it, and if you wanna pop up sometime, I'd love to go through
Yeah.
it. And we can maybe use some real
Yeah, 'cause
numbers and,
I know they manipulate deductibles and co-pays in all of the different areas, but I don't know where,
yeah.
so.
Yeah, I can help walk you through that a little bit. So as far as the actual county employees, getting back to that pay or play mandate, you pay 100% of the employee-only cost. You will never have to worry about affordability. All of our plans meet the minimum essential benefit requirements, the minimum value requirements. Since Mineral County does pay 100%, you'll never have to worry about affordability because it's free to them, obviously. But what that pay or play mandate, assuming when the new president comes in, that things don't change again, when looking to 2016, what that pay or play mandate means is that if any one of your employees was to go out to the marketplace and receive a subsidy because your health insurance was not affordable based on their income, you as the employer would be responsible for up to $3,000 per eligible employee as a tax penalty. So, again, you pay 100%, we don't have to worry about that, but that's sort of what that pay or play mandate, we call it the sledgehammer tax. And then there's also the other part of that, which we call the pickaxe tax, and that one limits the employer's liability to just that employee that were to go out to the marketplace and obtain that, where the sledgehammer, if one employee does it, you pay that tax penalty for all your employees. But the pickaxe tax, if one employee goes out and obtains marketplace coverage and the subsidy, your liability would just be for that employee. Now, again, your full-time employees, you won't have to worry about it. What this really nitpicks down to is any less than full-time employees, part-time, seasonal, 3/4 time, anything of that nature, they're throwing out, and you'll probably start hearing some of the rumblings because quite frankly, it's scary. The calculations that your payroll would have to do to calculate each employee's hours throughout the entire year. You have to have look-back periods, you have to have 30 days administrative periods, but essentially, you would, you'd probably be hiring for 2 more of her.
Kel's volunteering for that part right now.
Yeah,
I heard her
it's,
say.
it is really, really, really scary what's coming down the pike if you have to, but if you have to start doing this, which it is an employer mandate that you will have to calculate all of these non-full-time employees' hours. And we'll have lots of training sessions, and our legal counsel and staff are actually working on, with Black Mountain software. Do you guys use Black Mountain? So we're actually working on some solutions and talking to their programmers right now to see if we can't program or create a program that calculates all of that for them, because it literally is a nightmare.
So you just have to keep track of it like throughout the year?
By hours, by every month, and if at any one month that employee were to work over 130 hours, you would have to offer that employee coverage for that month. If you didn't, and they went out to the marketplace and obtained insurance, that's the pickaxe penalty.
So you offer coverage for 1 month?
If they work over 130 hours.
In 1 month?
Yep.
So what happens the next month when they don't work?
Then they wouldn't be eligible for coverage that month.
Okay.
Yeah, so there's,
Awesome.
yes, it's
I mean,
crazy.
that's
This is all
just
on the
not-
horizon. As Christina,
Don't you have like enrollment periods? I mean,
Yeah.
Then
Don't you have to be
enrollment,
employed
I
for
mean-
30 days before Mako will even start your health care coverage?
yeah, it's first of the month following, yes, and then you have, once you determine that they are eligible for 1 month or possibly 2, then you have a 30-day administration month where you can get your paperwork in order essentially
Yeah.
to offer them coverage, but then by that time they're probably not
They're not
eligible
there.
for coverage anymore. It's sickening crazy. Yeah,
So basically, we just better watch who we hire.
but
I mean,
well,
really, I mean, you watch
their hours.
Exactly.
yeah, it's, if you can hold an employee at 20 hours every week, that you'd probably never reach that 130. But what about your seasonals that work 40 hours a week for 3 or 4 months out of the year?
Yeah, I think we got
They technically would
2
be,
of those. Yeah, I was just gonna say, I know there's one in my.
yeah, they
There's-
technically would be eligible for health insurance benefits while they were working.
So is this gonna change for all employees?
All employers, this is a pay or play mandate is what it's affectionately known as. But it doesn't take effect, as Christina said, it's been postponed till 2016
So that gives me
now.
plenty of time to look for another job.
Yes, no, it gives us plenty of time to get the programming in place so that you don't have to worry about it.
So what if, like, say if they're like on Medicare or something, you know, they can waive that coverage, right? I mean, they
Yeah,
don't
it
have
does,
to take
it
we just
doesn't,
have to offer
and
it.
it doesn't, exactly. It doesn't mean that the employer has to pay for any of that, it just means it has to be offered.
Okay.
Yeah, so, we had suggestions come up from our benefits consultant that says, well, just offer the basic plan to every single employee. But that really more skirts around the real issue of your requirement, your IRS requirement of calculating those hours anyways. So, just offer it to everybody, then you don't have to calculate hours. Well, that kind of skirts around. Yeah, it solves the problem by covering the employer's bottom, if you would, by offering it to everybody, but it still doesn't officially have you complying with IRS guidelines of calculating those hours. So that's why Harold's actually in conversation with Black Mountain
So I mean, this
right
is gonna be
now.
like a monthly reporting, we're gonna have to report hours to somebody
Well,
every month?
that's what I'm assuming is coming, but again, it doesn't take effect till 2016. It's just scary, all of these guidelines and policies and
Yeah.
regulations that they're
That's
throwing
just
out there, but
nuts.
they don't know how it's going to affect the employers. So, and the loopholes with with the poverty levels and the wage incomes, and as I said, it's usually cheaper for the spouses to take the tax penalty than it is to even pay for health insurance.
So, okay, so say we have someone working 22 hours a week, you know, and we have to offer them health coverage, we don't have to pay for it?
Nope.
We just have to offer it?
Yep, that
Say, you know
satisfies the
what, since
employer
you're not a
needs.
full-time employee, you know, here's
Yep.
some.
Does that include an employee that's been working 10 years at part-time? That change would actually include them too.
Healthcare reform, that change will be for any employee working less than full-time, you would have to calculate hours for. Yeah, but again, that doesn't come down the pike now until 2016 for large group employers, so.
So my question would be, does that apply to, because we currently have grants that pay for full coverage on a part-time employee. Does that include for grants that pay for?
That I don't know, yeah, it's,
You shouldn't have brought that up.
Probably because we really operate where some of our people, their coverage is paid for, they work part-time, but the only way we can get people in there is we offer good
Health
benefits
insurance.
without the salaries, you know.
so I don't think it would change that, Peggy, because you're currently offering it to them now. It doesn't, the mandate doesn't say that the employer has to pay for anything. If the employer wanted to, or if there was a grant available,
Right.
that wouldn't matter. It's just that it says the coverage has to be offered if they work more than 130 hours in 1 month. So I don't think it would really affect that at all, because,
But it will affect part-time employees that I have if they've been working for the county and then all of a sudden in 2016, they are still working part-time, and then what you're saying is that the county is no longer responsible to cover their costs for their
no,
insurance.
they're not required to cover anything.
Oh.
But if a county chooses
Okay.
or continues to choose to pay for something, that's their option. All the mandate says is that it has to be offered to employees working more than 130 hours in any 1 month.
So our current policy that we have in place, commissioners, is that those that have been working part-time continue to get coverage, but any new employees that come on board will not get their insurance
So at
paid for.
some point, that may have to change, but again, it's based on calculations of hours. So-
But whether the county pays for it or not, it's kind of the county policy. It's up to them whether they want to pay for a
Oh, yeah.
part-time employee or a full-time.
The mandate
employee.
doesn't specify that you have to pay for it at all. It's
Okay,
just
so that's county policy.
to eliminate the liability of those tax penalties. That's where you have to calculate and make sure that if they're working more than 130
Yeah.
hours in any 1 month, they have health insurance offered to them.
So our job is just to offer it.
Let's boycott insurance.
Yeah, and again, as I said, there's so many goofy little ins and outs to this healthcare reform, and this is more than I've ever known about it as well in doing all of this research, but it's legitimate questions, and it's nothing that we as Mako Healthcare Trust can change. We can just help, such as working with Black Mountain Software, help counties come up with solutions to be able to weave through it as well.
So, is it a calendar month?
You would actually set, she's thinking about these calculations already. You have a
Because
year.
we're paid on
Getting it
Friday.
early.
You have a
Sometimes
year.
we have- Okay,
You have a year, but you would actually, the counties, the employers choose their calculation
okay.
year. So if they want it, January, or I guess it would be March through the end of April, they could choose that, or vice versa. But you could choose that.
I think it's calendar month.
Most people will stay with calendar year. But you could do fiscal, you would set that, you would set your calculation, and then you also have a 12-month look back as well, but that's all stuff,
I know.
you know, we don't even have
Don't
to,
stew.
don't
I
stew
know.
over it yet,
Stew
don't
yet.
look for
She
another
won't.
job.
She won't, you can see.
Yeah,
not
right?
bothering
She's
her
over
at
here
all.
doing this, she's
Huh.
not gonna look at
Well,
it.
that's gonna be weird.
Yeah, you can look it up online
Have a
if
nice
you
weekend.
actually have some time, you can look up what the mandate is and how they calculate the hours. It's mind-boggling.
Yeah.
But I think Black Mountain, in working with them, they have 46 of the 52 counties, so I think it would pretty much, if we get a program put into place with them, it would.
46 out of 52 counties. Good kidding.
So,
Okay.
Good.
I think that would greatly help all of our counties,
Good.
definitely, in weaving through
Good.
this and working through it, so that, we are working on that as well.
Okay.
And we'll have another healthcare reform meeting with our benefits consultant present. I believe that's slated for August, so once that date becomes available, I'll pass that on to all of our members, and I would highly encourage some representatives to attend. Not sure where it'll be, I'm thinking Helena, but I'm not sure as of this point. So, and that will be, we'll have legal counsel there and benefits consultant as well, and talk about healthcare reform and all the fun that it's causing us.
Any other questions? We're a little over here, so better wrap it up. Thank you to the commissioners for
And you'll be here.
supporting our
Yeah.
insurance for another year. We appreciate it. I can't tell you how much we appreciate it. It's good that you guys are doing that.
So we appreciate our employees.
That's a
So
great
anyway.
benefit.
If you send it for absentee ballot meetings.
Roman, you got any questions?
Nope.
All right, we're done.
Okay.
Thank you.